I'm going to be talking about coping and self-care today. If you're joining us for the first time, welcome. And if you're back from some of our other webinars, welcome back. Excited to have you here. So today we're going to be talking about coping and self-care and isolation. I'm going to go right through the presentation, and in the second portion, as Dan mentioned, we're going to have some time for questions and answers. We're going to have some time to discuss. So first, just a little bit about our program here. We're coming from the New Jersey Hope and Healing program through Rutgers University. And some of the services that we provide include short-term crisis counseling, emotional support, informational webinars, such as the one that we're all here today for, and we can provide referrals to additional resources. And you can visit our website to learn more about that or to access any of the services that we offer. In addition, as Dan mentioned, we do have one more webinar in this series. Next week at the same time, my colleague Kristen will be presenting on staying connected with family and friends during quarantine. Okay, so we're going to get started here, and we have been talking about this for the past few weeks, so if you're joining us again, this might be a bit of a review, but it's important to think about all of the ways that we are affected by the pandemic at this time, right? Because we're going to use our coping skills and self-care techniques to respond to the ways that we've been affected. So things such as disrupted daily living, our routines are disrupted, our schedules have changed. We've had to adapt to very new kinds of environments and routines. There's also a fear of illness, right? A lot of us are experiencing the effects of witnessing all of the illness and witnessing people we know and people we love contracting the illness. There's also grief and loss. We heard from Drew last week about ways we can deal with grief and loss and cope with things we've lost during this pandemic. Isolation is another really significant factor, and one that we can use a lot of self-care techniques and coping mechanisms to combat. Same with decreased social interaction. And in addition, the instability and uncertainty during this time can cause a lot of distress. So some common reactions that people experience to these factors can fall into different categories: physical, cognitive, emotional, and behavioral. And again, right, as we're looking at this, try to think of some of the ways that you might have been affected, because self-care and coping is so individualized, we want to use those techniques to respond to the ways we've been affected. So some things could be physical fatigue, changes in appetite, changes in sleeping patterns, and other physical symptoms could be different pains, different headaches are very common, stomach problems. We also may be experiencing differences in our emotions, experiencing loneliness, anxiety and depression. We heard from Demilola a few weeks ago about the anxiety and depression that are very common during this time. You might be feeling more angry or irritable. You may be experiencing hopelessness or numbness, apathy. Some cognitive reactions could include attentional difficulties. It could be very hard to focus during this time, plan in the same way you used to be able to. You might be feeling more forgetful, might be experiencing nightmares, and behavioral changes as well. So that could be changes in your energy level. You may be feeling more tearful than usual. You may have an increase in substance use. You may find that you're getting into more arguments, right? So as you're thinking about these, think about what you've experienced during this time or what you've seen the people around you experience. In response to that, I'd like you to take a minute to reflect on the ways that you take care of yourself, right? How have you responded to the things, the ways the pandemic has affected you? Right, and we all have ways of taking care of ourselves every day, and that can be very simple. It could be as simple as taking care of our really essential needs, like eating, our hygiene, our sleep, our physical health. But we can also do things that boost our mood, keep ourselves busy, make ourselves feel good. So I'd like you to just take a minute and think about the ways that you take care of yourself every day. What are things you do for yourself? So as we go on, I'd like you to keep those things in mind. Think about the ways, what you do, and as we go through the presentation, think about what else might work for you. What are the things you haven't tried? Maybe some things you have tried and you know they don't work, right? Just keep in mind your own experience and what you know works for you. Okay, so here are some general ways that we can cope, right? Movement can be really important, moving your body, especially now during this time when we're moving around a lot less than we used to. A lot of us are in the house a lot more than we used to be. So some examples of ways that you can incorporate movement into your day are seated stretches. And the information that Dan mentioned that's going to be sent out includes links to instructions for some seated stretches, right? But this is really anything you can do to move your joints, move your muscles, get your body moving a little bit. In addition, you can use muscle relaxation. So kind of tensing and relaxing your muscles in order to release tension. You can also do things you enjoy, right? You might sit in the sun, sit or stand outside if that's accessible to you. Go for a walk if you can. You might want to pick up old hobbies that you can kind of revisit, things you used to do. You can draw, paint, create art, write or cook, sing or play an instrument, play games, anything that you know that you enjoy. It's also important to keep your mind busy, right? Exercise your mind, right? We get a lot less stimulation than we used to if we're in the same space all the time. We're experiencing life in a very different way. Our brains, our minds don't get as much stimulation. So it can be important to keep your minds busy, right? And you can feel really good about gaining more knowledge. And especially now, online resources for learning new things, classes, seminars, webinars are much more accessible and much more available than they might have been in the past. You can also kind of read books, listen to audiobooks as a way to learn new things and kind of get that stimulation that your brain might not be getting. Another important thing to think about is easing our anxiety, right? There's a lot of heightened anxiety during this time. And we can do this through breathing exercises. Our breath is always accessible to us. It's always something we can come back to as a way to ground ourselves. So something like counting your breaths, breathing in and out for the same counts, things like that. And there's also mindfulness practice that you can do to help ease anxiety. And we're actually going to do a mindfulness exercise together a little bit later on in this presentation. So one way that we can think about coping and self-care following a disaster is breaking it into these three categories, right? So we want to increase the control we have over our environments. Like we said before, we've lost a lot of control and there's a lot of uncertainty. So we want to increase control in any way that we can. In addition, we want to increase connection, right? Connection with other people, social support is always a good thing. And especially during this disaster, during this pandemic, we've been experiencing that a lot less. So any ways that we can increase our connection with others is really important. We also want to promote coherence, right? Disasters such as this can really shake up our view of the world and the way we experience reality. So we also want to make sure that we can promote coherence, right? We can understand our environment, understand what's happening to us. Okay, so first, control, right? Things you can do to promote control. Plan out your daily activities, right? So establishing routine can be very, very important, right? Our routines really provide stability for us. So even if everything else in the world is very uncertain, there's a lot of things we don't know, you have your routines to fall back on. There's like at least some stability there that you can expect what's going to happen in your day, right? You have a routine and that's expected. You also might want to adjust your news intake, right? A lot of what is happening, we can't control, but we can control our media environment. We can make sure that we only consume media, consume the news for maybe a certain number of minutes or hours a day, or during certain times of the day. Being bombarded with a lot of negative news can really make you feel more out of control and affect your emotions. Keeping a journal is also a way that you can feel more in control, right? You can take ownership over what's happening in your day, your emotions, by writing them down. And it can also be really important to maintain regular eating and sleeping schedules, right? So anything you can do in order to regulate your eating and sleeping schedules. So one thing that can be really important is trying to eat meals at the same time every day. Even if we might have less structure, making that structure by eating at the same time every day, waking up at a similar time every day, going to sleep. That gives us more control over what happens. Okay, and connection, right? So right now we really have to shift the way we connect with others. We're really used to seeing other people in our daily lives, in our communities when we're out in the world, and that's shifted a lot. Right now, we have to be a lot more intentional about the connections we create, right? So that might include needing to schedule time to see loved ones and see the people that you might have normally seen throughout your day. So scheduling calls can be a really helpful way to do this, to build connection into your week, into your day. So that could be through telephone, through video conferencing, like Zoom or FaceTime. You can also reach out to people over social media. It's a really important resource during this time. It also could be a really good thing, not only to plan a time to talk, but to plan virtual activities together. Because typically, right, when we see people, we're doing things with them, we're interacting, we're doing more than just speaking with them. And it's something that we can really be missing during this time. So there's other ways that you can feel connected with others, even when they're not present. So one example is a loving kindness meditation. And this is the meditation that we're going to do a little bit later on, where you can call people into mind and think about them and really meditate on that, even if they're not with you. There's also online communities such as AARP that have classes, community boards, news and updates, and they even have specific pages and like communities where you can connect with other retirees. They have groups specifically for Black and African American retirees, Asian and Pacific Islander, Hispanic and Indigenous people, and even LGBT community for older adults. So the last aspect that we want to promote is coherence, right? So coherence is a way of making sense and meaning in the world. A lot of the ways that we typically make sense of the world and ascribe meaning to the world have been shifted, right? So sometimes we can be kind of consumed by other thoughts and overwhelmed, making it really hard to promote coherence and feel like we have a coherent sense of our day and of the world. And how we can promote this is through mindfulness, by observing our emotions and fears and reactions without judgment, right? So having a thought and observing it from an outside perspective instead of being consumed by it. You also want to try to stay in the present moment as much as possible. We can have a lot of concerns about the future and the past that bring us out of the present moment. But existing where we are at this time can really promote our coherence and our understanding of ourselves in the world. Okay, so now we're going to do a meditation together, right? So I would like everyone to just find a really comfortable seat Wherever you are in your room, you can close your eyes if you want, you can leave them open. If your video is on, feel free to turn it off so that you have a little bit more privacy while we do this. And I'm going to go ahead and play it. This is the last thing that we're going to be that I'm going to be presenting, and then we'll have some time to all reflect together about the presentation and about what this meditation was like for you. Okay, so I'm going to go ahead and play it. And if someone could just let me know if you can hear it, or that would be great. I just want to make sure.
Hi, it's Dr. Pearl here.
You hear.
I'm going to do a loving kindness meditation today. So please take a comfortable seated position, either in a chair or cross-legged on the floor or on a cushion, with a nice upright posture. Close your eyes and take a few deep breaths, a few deep cleansing breaths. So inhaling and exhaling. And for the first step in this meditation, I'd like you to begin thinking about somebody that you love unconditionally. So someone you love unconditionally, and with that person as your focal point, recite these 4 lines, either silently or aloud. May you be safe. May you be healthy. May you be happy. May you live with ease. May you be safe. May you be healthy. May you be happy. May you live with ease. And now I'd like you to repeat that with yourself as the focus. So now you say either aloud or silently to yourself, may I be safe. May I be healthy. May I be happy. May I live with ease. May I be safe. May I be healthy. May I be happy. May I live with ease. Now I'd like you to think of somebody who's a fairly neutral person in your life. You know, you don't like or you don't dislike them particularly. It could be like the barista or the checkout person at your grocery store. So somebody you feel fairly neutral about. So have them as the focal point. Think about them as you say, may you be safe. May you be healthy. May you be happy. May you live with ease. May you be safe. May you be healthy. May you be happy. May you live with ease. And now, as the focal point, I'd like you to think about somebody who perhaps irritates you or annoys you in some way. So have them as your focus. See them in your mind's eye as you tell them, may you be safe. May you be healthy. May you be happy. May you live with ease. May you be safe. May you be healthy. May you be happy. May you live with ease. So now I'd like you to think of all living beings. And so this is the meta of the loving kindness. So have all beings in your thoughts as you say to them, may you be safe. May you be healthy. May you be happy. May you live with ease. May you be safe. May you be happy. May you be healthy. May you live with ease. And it's really important in terms of cultivating loving kindness that we're first loving to ourselves. So as the final thought, I'd like you to again think of yourself. So have yourself as a focal point and repeat the process. May I be safe. May I be healthy. May I be happy. May I live with ease. May I be safe. May I be healthy. May I be happy. May I live with ease. So now you can let go of those sayings. Take another couple of nice, deep, cleansing breaths, feeling that safety, health, happiness, and ease for yourself and for others. So you can slowly open your eyes, and I wish you a safe, healthy, happy, and easy day. Till next time. Bye.
Okay, so that resource will also be available on the informational sheet that will be sent out. And at this time, we can stop the recording and we can start our question and answer portion.